Hi, good afternoon. This is Leilani Doyle. I'm the Director of Education and Awareness at Senior PsychCare. I'll welcome you to the webinar. We've got a few more folks joining, so I'm going to give everyone just a minute more to get on board, and we will start the webinar in about a minute. Please sit back and relax. We've got a lot of great content ahead of you, and we're so thrilled to be able to deliver this webinar. Since we've got a lot of good information to cover. So again, why don't we go ahead and get started? What we really want to talk about, we had another webinar planned, but some new information came to light about the vaccine, and it is so important that we all prepare for this. We all know what's going on, and we're very lucky to have some excellent speakers here to us. So from our perspective, the Senior PsychCare perspective is our mission is to create a better quality of life for seniors, staff, and their family. And no doubt, we all know it's been a challenge in 2020 to get this accomplished, but we've been hanging in there and doing a great job. We appreciate all the cooperation we've gotten from facilities and from the providers and the whole network out there in making this happen. And we're fortunate to be on the brink of this vaccine being in the hands of more and more people. It is clearly the single most impactful event that in terms of cooperation between government agencies, the federal funding, the private sector, and the pharmaceutical companies and researchers, and the distribution channels. So it is a pure marvel that we had this brought to bear so quickly. We didn't start from nothing. This is a virus that has its roots in other viruses very similar. So when this was tackled, the scientists had this information for a while, and you'll learn a little bit more about the history of this, so everyone can feel comfortable with the research that's been done, and the fact that we developed it so quickly is not just a 9-month effort. It's been going on for years based on a variant of it. So we're so excited about that. Joining me today is our CFO and Chief Operating Officer, Randy Frapart. Randy has been with Senior PsychCare for a number of years and is a vested interest in making this happen. He has been guiding us the whole way, and he's got some really good insight about the direction that Senior PsychCare did to continue to serve during this time. And then Sebastian LaRoche, who is the regional for Southeast Texas, has a background in healthcare services and very connected into the state level and government regulation and government organizations and the structures there. So he's been following these developments very, very closely. And so we are bringing you a very content-rich presentation today. It may be a lot to absorb, but we'll make it available for you after the presentation is complete, and you can share it with your friends and your colleagues. From a Senior PsychCare perspective, we have a strong commitment to the nursing home community. We listen, learn, and share. It's part of our core value to delivering our mission statement. I thought at this time we would ask our Chief Operating Officer, Randall Frapart, to say a few words about his commitment, the leadership that has gotten us to where we are today.
Thank you, Leilani. I would like to welcome everyone who's on the call, and I'd also like to welcome everyone that will be listening to this webinar, because we'll have it posted in the future. So for those who are present and those who will be present in the future, I'd like to welcome everyone. As a leader in this company, I've directed the company to be up to date on the impact of COVID. COVID's been around for 9 months or longer, and so it's very important for us to be up to date. Being up to date allows us to serve the nursing home and our patients with the ultimate patient care. Every step of the way, we attended to every detail, providing the PPE and safety measures critical to our face-to-face visits and a virtual health network for telehealth visits. Our providers and our company continue to provide the best of care. That is our goal. We see hope during this pandemic every step of the way with the advance of therapeutics and the mental health care that we strive to provide. We have much hope with the vaccine. In delivering compassionate care, which by the way is one of our core values, we inspire hope to improve the quality of life. I'm delighted to turn the webinar over to Sebastian, who has a healthcare background from both a policy and a research perspective. Sebastian also is our regional director of our Southeast region, which includes Houston, Beaumont, and surrounding areas.
Great. Thank you so much, Randall, for that introduction. Certainly, we've worked together for a lot of years, and truly, the Senior PsychCare is lucky to have a leader of your caliber working there and working for the seniors and the facilities in the area. You have inspired us all to go above and beyond, and always found the light at the end of the tunnel. So, so thank you for those opening remarks. And Sebastian, I know you have a lot of information to deliver. We'll try and make it as accessible as possible for our audience. Sebastian, you're on.
Excellent. Well, thank you so much, Randy and Lonnie, for your help putting this presentation together. So let me just jump straight in. We're not going to really talk about the statistics that are impacting our industry because we know it, we live it every day. So jumping into the actual updates on the vaccine candidates and what's being done to stop the spread of SARS-CoV-2. So vaccines are being developed across different research teams and companies and universities across the world. We see that back in April of 2020, more than 70% of the groups leading vaccine research efforts were from private industry. And this is what we find today with so many new vaccines being developed. Right now, researchers are testing 59 different vaccines in the clinical trials. There's 16 that are towards that final stage of testing. And there continues to be research on the remaining 87, another 87 or so preclinical vaccines that are currently being investigated under animals. And so the research is ongoing, and this has been going on for much longer than just this specific crisis. I think it's really important for us to remember that there are multiple forms of coronavirus. Some specifically look at their effect on humans. So the ones that come to mind are MERS, right? The Middle Eastern Respiratory Syndrome back in 2012. Within a few months, it spread to over 27 countries. Another prior to that, back in 2003, was SARS, Severe Acute Respiratory Syndrome, which is kind of a cousin of our current COVID-19 virus. And again, that one spread in a matter of a few months as well. And we've been able to get it contained. And so the research in coronavirus has been going on for years, if not decades. And so this kind of leads us up to where we are today with all of these new developments.
I thought that was a fascinating fact when we were preparing for this, when I was reviewing your research. I thought that was the most impactful piece of information that you oftentimes don't see in the news or what's coming out on Facebook or other sources of information there. So we weren't starting from ground zero. So that's a very big comforting factor.
Definitely. And this is something that hundreds of dollars have been invested into this research, and the safety is of paramount importance. So really, I think one thing to really talk about from the safety perspective, or just generally what's going on with the virus, is that and the vaccine, is that none of the vaccines that have been developed for COVID-19 will cause the disease in the body. What it does, rather, it attempts to expose the body to an antigen in order to provoke an immune response. Now, I'm not an expert in the field of biochemistry, but I will kind of give a quick summary about the immunization process in general. Generally, what would happen is the coronavirus, a pathogen, will enter the body. Coronavirus has a spike protein that's attached to the receptors, all the little knobs that you see around the coronavirus. And those spike proteins attach to the receptors of the human cells. And then that virus then gets absorbed or engulfed right into the cell. And the virus releases the RNA, which is part of that, the nucleic acid, or its structure. And it's really the genetic code. Essentially, it's like releasing the instructions to make a recipe. And then the next phase here is to make a protein. And so the cells will begin to read that RNA, generate those proteins, and then assemble it back into a virus. And so it's essentially what happens is the body starts generating an immune response once it identifies the cell and the virus, and it starts to learn how to attack or block the virus from spreading. And so I share that because it's important to understand that there are multiple ways to teach the body to stop the spread of a virus. And so there are about 8 different types that are being tried right now. And some of those are highlighted here below, from being a virus, a viral vector, nucleic acid, or protein-based. And we're going to really focus on the ones that are highest priority, which is on the next slide, the top vaccine candidates. Just for simplicity and emphasis on the 2 that are most likely to be rolled out in the next few days or weeks. So the 2 that we have are the Moderna vaccine and the Pfizer vaccine. And so what I think is really important to emphasize is that these 2 vaccines use the RNA platform. In a simple way of kind of explaining this is that these use the messenger RNA that basically teach the body to produce and attack a specific protein, not the whole virus, but to attack the specific protein. In this case, it's the spike protein that helps the virus attach to people's cells. The Pfizer vaccine and Moderna's use the genetic material to create the protein, and then from the virus, recognizable by the body's immune system. Once it's recognized, the body then can create an attack system to neutralize the virus. The other vaccines that are in development use genetically engineered viruses or proteins injected into the body, like we spoke about earlier, and so it's a slightly different process. The other really big thing worth noting are the different storage and handling requirements. The Pfizer vaccine has to be stored at ultra low temperatures, -90 to -60 degrees, and the Moderna vaccine has to be stored at slightly less cold temperatures, but still relatively cold at -25 to -15 degrees Celsius. And so that on its own is it's important to consider, because how do you transport these? How do you bring them to the facility? So a tremendous amount of infrastructure has to be developed and funded and supported.
Yeah, I think it's interesting, Sebastian. I know this RNA method that you talked about is something that has been used in some forms of cancer treatment, targeted cancer treatment with success. So I think that is a very fascinating use of this technology, or this proven technology in the vaccine arena.
The technology itself has been around we've been working on it for years, for several decades. That's why at least what the CDC is always explaining, and I think it's important to recognize that this type of vaccine has not been used or approved to be used as general in the past, but this one will be.
It's wonderful. And the other thing I noted, that I actually happened to have to go to the pharmacy this morning, and I did note the delivery of a refrigerated device that they were receiving right then. So it is really, really exciting to see that preparation going on.
Yes, the shipment is critical. And then the last part is that it really, both of these vaccines, unlike some of the ones that are still in that research development phase, these are 2-dose vaccines separated by either 3 weeks or 4 weeks. And so that also places a certain logistical component as to the fact that someone has to come back to get that second dose.
Okay, so both of these versions require 2 doses.
Yes, for it to really achieve the level of efficacy that we could talk about on this slide, and that's expected from this vaccine, which is very, very effective. So from the efficacy perspective, the Pfizer vaccine, based on their FDA briefing that they released last week, really is 95% has a 95% efficacy after 7 days after the second dose, right? So down the line. And so what we know after the trials with over 44,000 participants is that this vaccine holds the most promise. to the point where just last week on Thursday, there was a hearing that the FDA held and to disclose the information about this vaccine to the public. And then they were able to, on the next day, they went ahead and approved the Pfizer vaccine for emergency use authorization, EUA. And what's interesting about it is that because of the way this research was conducted, it actually is going to be used for, be allowed to be administered to those who are over 16 years of age. Starting this week, which is I think one of the most exciting developments, is that vaccine has already been shipped out, and we are seeing this week almost 2.9 million initial doses being sent out across the country. The Moderna vaccine, which very similar in the sense of efficacy, almost 30,000 participants. Again, these are very large sample sizes, and they submitted for emergency use authorization a week after the Pfizer vaccine. So the hearing is actually going to be held tomorrow. Although you'll probably see a lot of information just released this morning in preparation for that hearing that really shows a very high efficacy and safety component. One thing to kind of highlight is that neither of these vaccines have any preservatives. And so one thing that I think that's important to highlight, as well as just the fact that the side effects that have been disclosed have been really mild to moderate. What we find is that those vaccine recipients experience just some mild symptoms listed here, and that last for the most part within a day or two they resolve.
And I see you provided a nice link for additional information as part of the slide, which we'll make available post presentation. Okay, so maybe we're going to talk a little bit about how we get this rapid fire distribution. I know that this is part of the warp speed effort, and it's got to be on everyone's mind, especially the folks attending this webinar, what they need to do to get prepared for this.
Yes, so I think at this point we're all very familiar with Dr. Fauci's and his press conferences. One other person that's also really important is General Gus Pena. He's leading the Operation Warp Speed. The goal of Operation Warp Speed at the federal level is really to get the vaccines distributed to the millions of Americans. And the way they're really doing that is by, instead of using a simple linear process in getting vaccines approved, then starting the manufacturing, going to the next stage, which is distribution, we can start creating the plan. What the Warp Speed did is really start layering this in fashion where you have the vaccines that are getting approved while manufacturing is being developed, while the logistics are being planned. And the goal is to get these vaccines out to the public as quickly as possible. And so I think that the speed that we're seeing is a lot based on these different logistical components that have been developed, to the point where the Health and Human Services is working with the Department of Defense to get this out as quickly as possible by working with existing partnerships, working with FedEx, UPS, McKesson, to get those vaccines to the point of care. And those relationships are even being seen in the long-term care community, because what CDC has done is made agreements with CVS, Walgreens, and other large pharmaceutical companies to provide and administer the vaccines through a specific program that will have no out-of-pocket cost to the long-term care facilities receiving these vaccines. And I'll talk about that in just a second.
So especially that means that the long-term care facilities aren't going to be required to get one of these super refrigerators that store it at this sub-zero temperature, that a partner will deliver that and come to their facility?
Yes, that is what has been disclosed as the CVS Walgreens partnership, is essentially being able to go to the sites, to the long-term care sites, and be able to share and to really administer those vaccines. I think on the next slide I explain a little bit more about this partnership. So as part of this national vaccine strategy, the long-term care setting has an option to enroll in the pharmacy partnership and long-term care program And what this program provides is really end-to-end management, that management that you just talked about, Leilani, about on the COVID-19 vaccine process, which includes the storage, the handling, the cold chain management, on-site vaccinations, even fulfilling the reporting requirements to make sure that they're facilitating safe and effective vaccination to the homes, staff, the residents. All of this while still ensuring that the goal being is let's reduce the burden on the facilities from having to coordinate all of this. Let's have it done at this through this program, and make sure that these vaccines could be administered effectively to the staff and residents. If I think right now the registration for the program has closed on the federal level, but you can still register if you're a long-term care facility through the Department of State Health Services website. I think it's immunizedtexas.gov, and you can move from there through the portal.
I know a number have registered and have already registered, and sometimes included contracted staff like our staff or our providers there. So I know we've got a phased-in approach, and the fact that we've got it takes some time to get out there. Maybe you can walk us through what we see in Texas, because it is being controlled at a state-by-state level with the support of the federal government and the DoD.
Definitely. So I think you can kind of highlight here just the most current phases. The ones that we're really addressing are really the initial phases back in October and November, which was outreach education about these different programs, all the way through what's going to happen through January, July of 2021. And right now we're obviously in phase 1, which is getting the vaccines, administering the limited amount of supplies to the individuals that are of highest priority. ACIP, as well as the Texas has its own vaccine evaluation of vaccines panel. They've determined that the priority group being healthcare providers and long-term care residents and staff. And so that's where that phase 1 and phase 2 really is going to be targeted, with phase 2 targeting long-term care facilities and rural communities and things of that fashion. We did want to provide a quick update. So beyond just this phase process, as we continue to increase our vaccine doses, is that just last Friday, on December 14th, the governor announced that the Pfizer vaccine was going to be distributed throughout this week. And on this slide, we have the full list of hospitals, as well as a link to all of the long-term care facilities that have that have been approved to be part of the partnership program. With the first dosages now able to be administered as of Monday, and the dosages start to be sent out, the senior living industry, I would say, is from everything that the state has put out, is pretty close to distributing the COVID vaccine among its long-term care facilities. On Friday, the governor announced that most of our nursing homes and assisted living facilities have signed up for the pharmacy partnership for long-term care program, which, if you kind of think about it, that's over 225 certified beds. What he disclosed was that pharmacies, CVS, Walgreens specifically, would be receiving these shipments of vaccines starting not this week, but next week, the 21st, and with an expected distribution to be sometime December 28th, really January timeframe. And then once this happens, then they're going to be able to start scheduling with the long-term care facilities as well, making sure that the homes are very much aware of when the Walgreens CVS staff are going to go out there and provide these vaccines. Just in general, I don't want to spend too much time just to make sure we have enough time for questions, but here's some logistics that have been disclosed about how the vaccines are going to be distributed in long-term care. If you're really interested in the process, you can find additional details on the Walgreens and the CVS website. And they really talk about from the size of the room down to what the staff in the long-term care facilities need to be doing and how you can partner with them to get that done. So I did want to leave with just some considerations for our long-term care facilities and partners in general, is that our goal is one thing that I would recommend and is really to build that vaccine confidence and to continue to encourage vaccine acceptance in general. There is a fantastic toolkit that was developed by the CDC. So, and I have a link there that includes the FAQs, explanations about the virus, really anything that you would need to do some vaccine education and outreach. You can also develop a culture of acceptance by encouraging your PCPs or just talking to your PCP in general about the vaccine. You know, what is it that's important to the residents and their families, doing anything we can to just reduce any uncertainty and doubt. That said, everyone will have their opinion, but it's important that the experts on this really will continue to make themselves available.
Because I think that it's important to go to trusted sources, and I believe that's one of the values that you're bringing to the table today, Sebastian, is the depth of research you provided from the sources of authority. And I know there's a lot of misinformation out there or concern. I think being educated and consulting on each different situation for a patient, or the personal decisions that we all have to make is important, in addition to thinking about overall policy considerations for your facility when you're putting together a plan of action for getting this, and CVS or Walgreens is reaching out to coordinate your schedule. It might be helpful to have some standard policies or guidelines or information packets available, and and also communicating that to others behind that.
I couldn't say exactly, very true. It's all about ensuring that we have good, clear lines of communication from what the vaccine is down to the distribution plans, making sure we're prepared, communicating with our partners, including vendors such as us in the long-term care space, so that we can work in unison with our homes to be making sure we're communicating the right messaging on the way. And just if there's any changes in their internal operating policies, that those be communicated so that there is never any disruption in care, and that we really could have that continuity.
That is something we valued a lot during the early phases of the virus outbreak, was having that collaborative messaging between the contracted facilities, so we understood what their requirements were for entry. We implemented other alternative delivery systems there, and I think that method of communication needs to hold true as we move into this vaccination plan phased in approach, so that as Cedar PsychCare is delivering consistent quality care to patients with a combination of in-person and telemedicine visits, knowing that standard and being able to achieve that is something we need to plan for. And if it requires a vaccination, we're not automatically included in the first phase. If I understood the phased out approach, Sebastian, I understand that the staff that works at the facilities are there and included and counted in the phased rollout, but where the providers that aren't full-time staff are not necessarily counted, although I understand some of the facilities have counted some of our staff there. Did I capture that accurately?
Yes, in a way, yes. I think it's still too soon to be able to make that determination in terms of what our providers should be doing. But what I would say is the facilities are working right now on scheduling those visits with the Walgreens, the CVS, and the pharmacies, coordinating all of that as the vaccine doses increase. So once we have a better idea about the distribution of the vaccine, then we'll have a better plan moving forward as to the scheduling, number of doses that will be delivered at each site, and things of that nature. And so until we get the volume of doses built up, the capacity to deliver vaccines, then we're going to have a better idea as to the requests that are being made by the long-term care facilities and how many dosages, because it is at the end just recommended in the home. So how that's going to be rolled out will be very much at the forefront.
Because I understand that because of the limited shelf life, especially of the first vaccine, that having accurate counts and shipping it those numbers that will all be used to the location is critical to make the best use of the limited vaccine supplies. So it is something we have to be cognizant of, and clear communication and collaborative communication is key all the way around for doing that.
Precisely.
What about monitoring patients? I know we talked a little bit about the side effects that have been noted in the test group. Is there any suggestions there? I know we're not the medical, we're in a different area, but based on your research, is there some guidelines that have been published there?
The CDC has been very open about just making sure we're following the proper procedure when it comes to reporting any adverse effects. It's also incumbent that all of us are monitoring symptoms. So you could always submit any adverse effects through the VAR system, which will continue to work, which is the vaccine adverse effects reporting system that the CDC and the FDA operate. In addition to that, I do know that they plan on sharing information about VSafe, which is an app that people who've gotten the vaccine will be able to download, and that will help track any adverse reactions should they experience anything. So they're going to continue to track that information. We're going to get all of that data very quickly. So hopefully they'll be able to process it and communicate that to the.
Any other considerations in terms of we haven't already discussed?
And then I just want to emphasize again the importance of communicating and knowing that at the end this information is we're sharing it because it's important that we all understand what's happening with the vaccine, what the distribution plan is. That is still subject to change, as you know, on the weekly basis. We're learning more and more, and that as partners with our long-term care facilities, as caregivers of residents, we are in the best position to work through this process, as we now have a little bit of a light in some pretty dark days.
Absolutely. So tell me a little bit about the logistics that you've seen or you've heard based on the details you've researched.
Well, generally speaking, it's all in that information there. But what we find is that CVS and Walgreens will be able to inoculate the residents in the home, so they'll have a site set up with a immunization table, and they're going to have an administration area and then a little waiting area, making sure it's still 6 feet apart. Because I think the most important thing is, even if with these vaccines do roll out, CDC continues to emphasize that that we still have to follow PPE. We still have to continue to wash our hands. We still have to keep distancing and wearing masks until that status changes. Our priority really is on keeping everyone safe, and so that's essentially what the CDC keeps emphasizing. And so even in this vaccination process, there's still that in mind. And as an example of things to keep in mind is also a resident that comes into the home and they only get the first dose of the vaccine. So making sure there's plans for, and then they get released, right? Discharged. So how does that person still continue to get the second round of the vaccine so that he has the full efficacy? So a lot of these logistics are still in planning and have been discussed. And we're likely to continue to hear more from the pharmaceutical companies, from the states, from the regional advisory councils as well.
We're fortunate to have you staying in touch with everyone. I think that is a really good point about the second round and making sure you have the procedures in place to conduct it, to schedule it, to get on the list. And I'm sure that's got to be a logistical problem for the distributors to solve in terms of making sure both they have enough supply for both round one and round two for the facilities they've delivered there. Great. So Sebastian, thank you again for sharing all this information. I know it's a lot of detail behind this. I thought the information about how the vaccine works and the research that's gone into it, providing the links to resources and the logistical plan that we pulled together in terms of the phased-in approach was very, very valuable. I thought at this time, we're open up for questions. I haven't seen any questions come in, but we do have a lot of folks on the line. So if you didn't have a chance to write your question or you need more time to digest this content, please feel free to send them, send contact information to SBC Cares at SBC Health. I would like to invite Randy to come back and give his perspective, because I know we talked a lot about policies and procedures and what is happening at the facilities, but from Senior PsychCare's perspective, we also have those kind of considerations. So Randall, would you mind stepping back in and kind of tying things up for everyone?
Sure. First of all, I want to thank both Leilani and Sebastian for all the work, and you should note that this was probably 16 slides in length. I mean, we had 30 slides and we condensed it in the effort of respecting everyone's time and filling out and determining what was the most relevant information at the time. But like we talk about the 0 phase 1 and 2, there's also phase 3 and 4. We saw all kinds of information about other companies that are working on vaccines and such. But we really developed it to what we think is relevant today and for the next couple of months. One of the things that's important and something that I practice as much as I can is at our company and with our employees and with all the nursing homes. I really think enhanced communication is extremely important. So we created this innovation series. This is our 3rd one, and we will continue to do this, not to mention the internal emails that we're sending to one another and all the communication that we have with our regional staff and the providers at large. So we will continue to do that, and that really is critical during COVID-19, this pandemic we're operating under. So our goal is to remain up to date. As Sebastian indicated, nursing homes and hospitals are in the 1st phase of distribution. We believe that some of our providers are eligible to receive the vaccination in the nursing home setting. So we encourage our providers to reach out to nursing home staff and be part of the process. Our director of HR at SBC and our regional directors and their staff will assist every step of the way by consolidating all the relevant information of their region. SBC staff will reach out to determine what resources are available. And if providers are unable to get the vaccine as part of phase 1, we will continue our efforts through phase 2. Again, SBC providers should work with your regional director and our HR department. We will continue to act. This is very important. We'll continue to act in accordance with CDC guidelines in donning masks and face shields, maintaining social distance where appropriate, and to expand our virtual health network for not just the telehealth visit, but in onboarding a new nursing home and in serving an existing home with patient information flow. We will continue to update our company and the nursing home community as we learn more. And I really want to thank everyone for joining us today.
Thank you. I know we're pushing up and I know everyone's very busy, but please, if you have a question that you don't feel comfortable asking in this forum, please feel free to reach out to us directly. We're happy to answer that. We'll also be posting this out on our seniorpsychcare.com, and so you can share it with your friends. I think this is valuable information. And if you have thoughts about future topics, or if you'd like to see a follow-up to this content after the webinar is after the webinar is over, and if you want to see what's happening as the vaccine process goes out, let us know. We're always looking for innovation series topics that come from our audience. Many audience members or our facilities have given us great ideas for areas of interest that they'd like to cover, and we're always open to that. Again, we'll be sharing all this content. We thank everyone for your time and appreciate you working with us together to get through this challenging environment. It is nice to wind up the year with a glimpse of hope. So I will end the webinar and wish you all the very best of a holiday season. Thank you.
Thank you.
Yeah.